Hi, my name is Guy LaRue. I'm an IV nurse that works out in the Puget Sound area. I have a company called Precision Vascular Services. We've provided IV services for about 30 years, placed over 45,000 lines and of different types, and we're supposed to make sure these lines last with a focus on quality, on positive patient outcomes, and cost. If I haven't already mentioned that, we have developed a unique dressing technique that we use, very special circumstances, and we've been asked by many of the people that we teach to put this on a YouTube video. So that's what we're going to do today with the help of my sister-in-law Cindy and my nephew Alec. He's running the camera. We are going to show you how to do this dressing technique. So one of the things we do to make sure our outcomes, and if I didn't mention it, our typical midlines are 20 centimeters long, the ones we're using now. It's BioFlow is the technology, and we've found a very low thrombus rate. But you can see from this picture here on Cindy, we've got this line mid to upper arm is where we place the tips, or we place the catheter, and at 20 centimeters, it's at approximately the subclavian axillary junction right here inside of her. And we verify tip position with ultrasonography to make sure that we can actually see it, and we make sure it's in a large vessel. So anyway, our outcomes are, I know midlines have in the past been said 28 days, but that's brand specific, and we have not found that that's a reasonable guideline. With our catheters, they can last several months. There's no real limitation except on when the therapy ends. Or if some problems arise, but problems rarely arise. One of the problems that we've had, though, is with dementia patients or with patients who have reactions to the clear transparent dressings that are readily available. So we had to develop a new technique for those particular patients. In addition, one of the things we do with our catheters is we suture them in place as opposed to using adhesives. We have found that we have had to replace many fewer catheters using this technique. It's a simple single stitch that goes around, wraps around. I won't go into details about that right now. Just want to let you know that that's a secondary technique that we use to make these stay in. But that was one of our biggest problems when we first started doing these catheters, was they would come out. Regardless, there are several kinds of, I don't have one here, but there are several kinds of devices that you can use to hold the catheters in, but those cause skin irritation. In our experience, cause skin irritation, and we just decided to go with the suture technique. It's a silk, zero silk suture, single suture, and those we've had a lot fewer problems, and mostly, more importantly, is very few of them ever come out when we use the suture technique. So for this demonstration, however, and I'm going to get started right now, we're going to assume that we don't have a suture in this particular catheter, and you're still going to be able to see how well this dressing technique works. Okay, so we're going to assume that you've cleaned this up. I will put gloves on, but it's not really, we're not trying to demonstrate how you did the cleaning technique. We're not trying to demonstrate sterile technique in this case. We're simply trying to show you how to apply this dressing. So you have a catheter that a dementia patient is pulling out, or you have a lot of erythema around here. The patient cannot tolerate any dressing. They're sweaty, they're diaphoretic. So really no dressing is working here. So your only option is to do a dry dressing. And with the dementia patient, this works the same way. You can have perfectly good skin, but the dementia patient will just pull these out. Oftentimes, even with sutures in, they'll pull them out. So we are going to show you how to prevent these from getting pulled out, or at least decrease it significantly. So this is an old technique I learned in the Army. You take a 4.5-inch gauze roll, and you start out just below where the catheter is exiting the exit site, and you take the first lap around. You have the tail of your dressing sticking out here. Now you're going to take and pull that up snug. Your second lap around is going to actually catch that tail. Now what that does is that prevents that tail from sticking out and getting pulled out and then dangling around, and next thing you know, they're able to get hold of the whole dressing comes undone. So we got it anchored and we're ready to start the actual anchoring process. So what we do is right above where the tube is exiting your dressing. Now, by the way, while we're here, I want you to just take a look at this. We have approximately 1.5 centimeters right here, and you can see from her freckle where that's located. And we'll then, after we're done doing a pull test on it, we'll show you how much it moved from that site. And again, it's not sutured. The only thing that's holding this here is the tape. All right, so your first loop around the top, look, remember it's twisted right there. That twist adds increased pressure compared to the rest of your dressing. Now we're going to come around and we're going to do that below. So we got another twist right there. And by the way, you can reuse these gauzes. This also saves money. If you want to check your dressing or check the site, you can do this every day if you wanted to. We don't recommend that because it's just not that necessary. Although INS practice seems to be with my peers that they want to see that site all the time. It's odd that, you know, surgical dressings often aren't viewed for, or surgical sites aren't viewed for a week after you put on a big gauze dressing, but we have a little slightly different standards with IV therapy, even though it doesn't necessarily it's not necessarily evidence-based. All right, so again, we're twisting over the top and over the bottom. And then we're going, making another full loop around here just to make the thing look nicer. Twist underneath. Twist over the top. All right, so I've got a couple of pieces of tape ready. You just put a little tab in them. This will make it easier to take this off when you want to take a look at the site or change the dressing. Now, a lot of people are critical of this dressing because they say, oh, you've got to be able to see your IV site. That's a standard INS thing to, statement from INS members that you've got to be able to see your IV site. Well, we model ours based on still a weekly dressing change, unless the patient complains or unless you see redness up here or anywhere below, you see swelling in the hand. Those are the biggest signs we have of complications from these lines. There should be no swelling here, and there should be no redness and no complaints of pain. But I want to do a little pull test here. So I'm going to use my major scientific instrument here. This is a fish weight scale. And we're going to see how many pounds of pull we can take that this dressing can handle. I'm going to try and just loop this through and catch on one of the pieces of plastic here. Yeah, there we go. All right, so I'm just going to pull on it. I'm going to pull this way, pull this way, pull that way. You can pull anywhere. And we've gotten it up to, on this scale, 8.5 pounds of pull, and I'm not pulling it to the point where it dislodges, but so 8.5 pounds of pull. So now you've got something you can compare your dressing technique at home. You can also, with your dementia patients, you can use your last lap or two to simply go around your device like this and hide it basically from their view. You can get to your clamp, so you can modify this. This is not any real written in stone technique. I tell people they can use bubble gum to hold it in if it's sterile and it keeps it in. So this is just a technique that we use, and we modify it as depending on the patient's needs and depending on how easy it is to get your tape off. Oh, Cindy wants to help. Yeah. Anyway, you you get the idea. I'll just use a piece of tape from over here. All right, that's fun. I just happen to have that there. But again, it doesn't really matter. And in this case, you can get to the clamp. You can get to your insertion site. It's kind of out of the way of the patient to get to. And the real point is, this is hard to pull out. We've actually found it's a better dressing. It secures it better than regular transparent dressing. So Cindy, can you tell me how comfortable that is?
Absolutely.
You were not coached in this, were you?
I was not. It doesn't feel constricted. I feel nothing.
Yeah, isn't that? And we found that with confused patients like yourself, this is a perfect dressing technique. And you can play with it. And usually what we found is people with dementia will reach up here and touch this and then just leave it alone, as opposed to picking at it. What's the other thing? Oh, so again, if you have redness under there, that skin is breathing right now. And so we've had episodes where they get Candida albicans growth underneath their dressings because it accidentally got wet. And then you put this dressing on for a couple of weeks and it'll heal up underneath there. So, and there's no other way to really handle Candida albicans other than to let air come in, and it'll die off slowly. All right, so now we are going to take this off, and we're going to see how far that moved with all that pulling and torquing. Again, you can reuse this if you roll them up nicely. You can reuse, and saving money is very important in long-term care, as Cindy and I were talking about earlier. It's just, you can already see right here. Remember I was showing you the freckle? There, it hasn't moved a centimeter. It hasn't moved a tiny bit. So if your dressing can do that and still have the skin dry, well then keep doing your dressing technique. Otherwise, you have a new option to use. And we change these about, again, once a week, just like a surgical dressing would be changed. And right now, well, I guess that's it. So if you have any questions or comments, put them in the comment section. And I hope this helps you, and take what you want and leave the rest. Bye.